Good afternoon, everybody, and thanks so much for joining us here on KXAN Live. I'm Will DuPree in the KXAN Live studio. We hope you're enjoying your Friday afternoon, but we wanted to alert you to something that has come up in the last 24 hours or so. The CDC has recently upgraded the COVID-19 risk level for Travis County and two others in our area from low to medium, and we'll explain why that is in just a moment with an expert, but wanted to show you this map really quickly, showing you which other counties in our area have changed their COVID-19 risk level. Those include Travis, Hays, and Caldwell counties. Those are the ones shown in yellow on this map compiled by our data reporter. All the other ones in our area are considered at low risk by the CDC at this point, but of course we'll keep monitoring those conditions. We wanted to find out why exactly Travis County has changed from low to medium level risk, and fortunately, we are here today joined by Dr. Desmar Walkes. She is the health authority for Austin-Travis County, and she is very fortunate to join us here and give us some time today to answer some questions about this. So, Dr. Walkes, thank you for being here. We really do appreciate it.
Hi, thank you for having me.
First of all, let's explain what led to this situation. We've enjoyed a period of time where Travis County was considered at that low level of risk for COVID-19 by the CDC. What changed?
We've had a number of events in our area where there were gatherings, multi-generational gatherings for graduations and other festivities. We've seen a decrease in the level of immunity as people are, due to have those booster shots. So that, in combination with the emergence of two new variants, BA.4 and BA.5, which are Omicron subtypes that are more easily spread, produce this perfect storm, and we're seeing a rise in cases.
A lot of people, I imagine, are at home taking those rapid tests to see if they have that infection. Is that factoring into the level of infection we're seeing in the community? Do you think that it might be worse than what the numbers you all have coming into Austin Public Health are now?
Yes, we know that because there are a lot of people doing home testing that are, suffering from mild disease, that we're not seeing or getting reports of all of the cases that are out there. So we're monitoring things like wastewater and what's happening in our hospitals and in other healthcare facilities across the county.
For people who do get a positive test result in a rapid test at home, what should they do? Should they share those results with any certain entity, particularly Austin Public Health?
They can do so, but they should reach out to their provider to find out if they're eligible for treatment with either oral antiviral medications or monoclonal antibody infusion therapy to treat COVID-19 so that they can get better and avoid having to be hospitalized.
Because the CDC has now upgraded Travis County to that medium level of risk, what are the things that people should do out there to stay safe and not get sick?
Well, first of all, get vaccinated and boosted if you're eligible for a booster. Those that are over age 50 are now eligible for a second booster. Anyone over age 5 is eligible for a booster. And then take those extra precautions in situations where you're going to be in an indoor public space. Wear a mask. We support people making that choice to wear a mask in situations where they're around people they don't live with who might be sick. And finally, if you're sick, stay home, get tested. If you have a sniffle, test yourself to see if you have COVID. It can mimic some other conditions that we are commonly, dealing with here in Central Texas, like allergies, common colds, that sort of thing. So get tested so that you can protect your family and your coworkers and keep us from spreading this disease more throughout our community.
You mentioned just a few moments ago about the certain variants that are circulating in the community. Can you reiterate that information to people so that they can understand really what's driving a lot of these infections?
So as we've gone through this pandemic, the coronavirus that was the initial source of disease way back in March of 2020 has changed and mutated and developed new forms, variants as we call them. And each successive one has been more adept at moving from person to person or spreading, or the technical word we've been using is transmitting between people. So that transmission or spread between people, as it gets to be more adept at doing that, better at doing that, makes it something that causes us to have increase in cases or surge in cases. And that is a situation that we found ourselves in January, where we had a big surge in cases. A lot of people got sick very quickly. Fortunately, many people had mild disease, but because this particular virus in certain individuals can cause more severe disease and cause them to need to be hospitalized, and some will need life support and some may succumb to the illness and die. We are still remaining vigilant about telling people to be careful not to get COVID. And then additionally, this particular virus can cause something called long COVID, which is a condition that can last a few weeks to a couple of months, where you may have fatigue, aching, different types of symptoms, rash, etc., and can be very incapacitating in some people. And so the virus may resolve or you may get better, but you have the possibility of developing something else in addition to that. There's also some multi-system inflammatory conditions that we've seen, particularly in children and young adults. And in some instances, we've seen people who develop diabetes and problems with their heart and high blood pressure. So it's not something that is just a common cold that comes and goes. It can cause some after effects. So even though we're seeing milder illness, we need to protect ourselves from getting COVID by getting vaccinated, getting boosted if you're eligible, and when when the need arises, wearing a mask.
You did mention that case numbers are going up in our community. What about in the hospitals? Can you give us a status update about where those are right now?
So our hospital numbers are starting to go up. We were enjoying a relative calm for several weeks, and we've now got almost 60 people in hospital who are COVID positive, people in ICU, on ventilators. So, that's typically what we see at the beginning of surges. We saw this number of patients early in January with the initial Omicron surge. We've had case reports and confirmed case reports of BA.2 and BA.5, which are those types, variants of the Omicron virus, COVID, that I talked about earlier. And so we know that spreads more, and we're concerned that we need to get that message out to everyone in our community that a couple weeks ago we started saying, we're relaxing now, but we might call on you to start thinking about masking indoors again, especially if you're around people at risk. Well, the time has come to start doing that.
Right now, it's no surprise to you that many people are living their lives normally as we did before the pandemic hit.
Mm-hmm.
How much harder is it now to share this bit of advice for people to stay safe and take some precautions, given where people are now in living their lives?
Everybody has gotten sick of hearing about COVID. They've got the COVID fatigue, and I get it. I understand, but we still have people dying. from COVID. Not as many as we had initially, but there are still lives that are being affected by COVID. So for the price of wearing a mask when you go to get groceries so that you don't bring COVID back home to your unvaccinated loved ones or somebody that you encounter who is at risk because they have cancer or they have high blood pressure or they're overweight. That's the price, the small price that we're asked to pay just to get through this next few weeks as we, experience what we know has happened because we've had a lot of festivities for graduations and other things in the last few weeks. And if we do that, then we can continue to go on and continue to see what it looks like on the other side of what's been a long 2 years of pandemic response.
Dr. Desmar Walkes is the Austin-Travis County Health Authority, and she's been kind enough to join us to answer some questions about the CDC upgrading our COVID-19 risk level in Travis County. Dr. Walkes, thank you for taking time today to do this and answering some questions,
Thanks.
and I'm sure we'll talk again soon.
Thank you. Take care.
All right, everybody. That again is Dr. Desmar Walkes. If you want to find out more information about this upgrading of risk level for COVID-19 in our area and in some of the neighboring counties, you can find that on our website, KXAN.com, and on the KXAN News app that you can download on your smartphone. If you haven't done so already, please do so. Thank you all again for watching here this afternoon. I'm Will DuPree. Hope you all enjoy the rest of your Friday afternoon and your weekend. Please stay cool out there, and we'll see you again. Take care.